بسم الله الحمد لله والصلاة والسلام على نبينا محمد وعلى آله وصحبه وسلم. Inshallah, today in this lecture we'll talk about the adrenergic agonist, what is called sympathomimetic drugs, the drugs that activate the adrenergic receptors, alpha and beta receptors, either directly or indirectly. First, we'll talk about the adrenergic transmission. Just like the cholinergic transmission in the previous lecture, in the adrenergic transmission, we'll see the biosynthesis of the catecholamine, the storage, then the release, and last, the degradation. First, the adrenergic neurons, as we know, they are found on the sympathetic nervous system, exactly on the post-ganglionic fibers, the fibers that innervate the effector organs, as we know, smooth muscle, cardiac muscles, or glands. Also, we will find the adrenergic neurons in the central nervous system. They are responsible for the functions on the central nervous system. Inshallah, we'll talk about on the coming semester. The adrenergic transmission involves 5 steps, just like I said, like the cholinergic transmission. These involve synthesis, storage, release, then receptor binding to the adrenergic receptors, alpha and beta receptors, presynaptic or postsynaptic receptor. Then this binding is followed by the rapid removal of the neurotransmitter from the synaptic cleft. This rapid removal either by enzymes, monoamine oxidase enzyme, catechol or methyltransferase, or by the uptake. First, this is the biosynthesis of the catecholamines. The biosynthesis of the catecholamine start from the metabolic precursor, the L-tyrosine, the amino acid tyrosine, L-tyrosine, which is taken up to the nerve terminal by means of the carrier molecule taken up to the nerve terminal, just like the choline uptake في الcholinergic neurons. The metabolic precursor L-tyrosine taken up to the nerve terminal by specific transporter system, as I mentioned, just like that, the transporter for the choline. Then the tyrosine is hydroxylated by the enzyme tyrosine hydroxylase, and this is a very important enzyme. It's a rate, so that is a rate limiting step, tyrosine hydroxylase, which will add at the hydroxyl group. Hydroxylase means this enzyme will add hydroxyl group at this position. This will lead to a compound called DOPA, dihydroxyvinyl aniline, which is abbreviated بنختصره ب DOPA, dihydroxyvinyl aniline, DOPA. Then this compound by the means of another enzyme, DOPA decarboxylase, by the enzyme of DOPA decarboxylase, will remove this carboxylic group, leading to dopamine. DOPA decarboxylase will remove the carboxylic group, leading to dopamine. Dopamine is then decarboxylated by the enzyme DOPA decarboxylase to form dopamine, which is hydroxylated to form noradrenaline by the enzyme known as dopamine beta hydroxylase. This enzyme, dopamine beta hydroxylase, will add hydroxyl group at this position, this alpha position, because the numbering starts from the functioning group, amine group, this alpha position, and this is a beta position. So this is the enzyme called beta hydroxylase, will add the hydroxyl group at this position, leading to noradrenaline, which then stored on the vesicles of the adrenergic neurons Last, in the adrenal medulla, which secrete adrenaline, dopamine. To the dopamine, we have an enzyme called phenylethylamine N-methyltransferase. N-methyltransferase معناه this enzyme will transfer a methyl group to the N, to the amino group, leading to adrenaline. We know that adrenaline is different from noradrenaline only by this methyl group which attached to the amine جروب. نور ادرينالين نور لانه ما في ميثايل جروب عشان كده سميناه نور ادرينالين. while adrenaline there is a methyl group added by this enzyme phenylethylamine N-methyltransferase to form adrenaline, and the adrenaline secreted, as we know, on the from the adrenal medulla, secreted on the bloodstream. This is upon the sympathetic activation. Now we'll talk about the drugs that affect the biosynthesis, storage, and release of the catecholamine. And the first drug that affect this biosynthesis is alpha-methyltyrosine. Alpha-methyltyrosine is a drug that inhibits tyrosine hydroxylase, and we know that this is a rate-limiting step. By inhibition of this enzyme, tyrosine hydroxylase, so this will prevent the formation of DOPA and then dopamine and noradrenaline, so will inhibit the biosynthesis of the catecholamines. This drug, alpha-methyltyrosine, is used for treatment of pheochromocytoma. Pheochromocytoma is a tumor of the adrenal medulla, and the adrenal medulla secrete adrenaline. So in case of tumor, there is a increased proliferation of functioning cells that secrete an adrenaline. So there is an excess circulating adrenaline, and the patient with pheochromocytoma is usually diagnosed with hypertension due to the excess circulating adrenaline, leading to the hypertension. So alpha-methyltyrosine is a drug that inhibit biosynthesis of catecholamine, inhibit the synthesis of adrenaline, so it's used for treatment of pheochromocytoma. The second drug that affect the biosynthesis of catecholamines, we have carbidopa and benserazide. These are two drugs. These two drugs inhibit the second enzyme, the biosynthesis of catecholamines, اللي هو الدوبا decarboxylase. The enzyme dopa decarboxylase, which remove a carboxylic group from الدوبا to form dopamine. This enzyme inhibited by drugs such as carbidopa and benserazide. These drugs called peripheral dopa decarboxylase. Peripheral dopa decarboxylase because these two drugs cannot cross the blood-brain barrier, so they will only act peripherally. So they inhibit the peripheral conversion of dopa to dopamine, and these are used for treatment of Parkinsonism, and inshallah we'll talk in more details about this when we talk about the pharmacology of the central nervous system. The third drugs that can affect the biosynthesis of catecholamines, we have methyl dopa. Methyl dopa is a drug that taken up by the neuron itself, and when it take up on the nerve terminal, it treated as the neurons treated methyl dopa as a dopa زي الدوبا الموجود في النيرف تيرمينال. هيحصل له معناها هيحصل له بيتا هيدروكسيليشن، يتحول ل اللي هو ميثايل دوبامين، يتحول لميثايل دوبامين. بعد ذاك يحصل له ديكاربوكسيليشن، ريموفال للكاربوكسيليك جروب، يتحول لالفا ميثايل نور ادرينالين. والالفا ميثايل نور ادرينالين هيحصل له accumulation، يحصل له باكيجنج، يحصل له ستورج في الفيزيكلز. لكن بعد ذاك لما يجي اكشن بوتنشال ويحصل ريليز المفروض يحصل ريليز للنيورو ترانسميتر بتاعنا، هيحصل ريليز للالفا ميثايل نور ادرينالين والالفا ميثايل نور ادرينالين هو عباره عن false neurotransmitter. false neurotransmitter معناها it cannot activate the adrenergic receptors. It cannot activate the alpha or the beta receptors, so that it considered as false neurotransmitter. And the methyl dopa is one of the drugs that used for treatment of hypertension. Especially, it is a drug of choice for treatment of pregnancy hypertension because it's safe during pregnancy. The fourth drug that affects the biosynthesis of the catecholamines is the drug that called reserpine. Reserpine the first drug that used for treatment of hypertension in history. It's obtained from a plant called Rauwolfia, and this is considered the first drug that used for treatment of hypertension. Reserpine acts by interfering with the carrier that is responsible for noradrenaline storage, leading to depletion of noradrenaline, just like the besamicol on the cholinergic neurons. It inhibits the accumulation, the storage of noradrenaline on the vesicles, leading to the depletion of noradrenaline from the storage from the vesicles. So when there is an action potential, there is a few or not at all stored noradrenaline. The last one, the drug called guanethidine, and the guanethidine inhibits the release of noradrenaline from the synaptic nerve terminal. It blocks the release. The only one of these drugs that inhibit the release of noradrenaline, interfere with the release, or inhibit the release of noradrenaline from the synaptic nerve terminal. So it leads to sympathetic failure. So guanethidine is used for treatment for hypertension. Also, is one of the drugs that used historically for treatment of hypertension, but due to its side effects, nowadays it's not used as a drug for treatment of hypertension. Now we'll talk about the uptake and degradation of the catecholamines. As we saw, catecholamines after synthesis, it's stored on the vesicles, and when there is an action potential upon the nerve terminal, it released and act on its receptor. هتكلم عنها by the end of the lecture. Adrenergic receptors, alpha or beta receptors. After doing its effect on the adrenergic receptors, بيحصل لها degradation للكاتيكولامينز او termination للاكشن بتاعها. termination بتاع الاكشن either by الابتيك carrier molecule that uptake the catecholamine either inside the neuron itself, and this is called uptake 1, or on other tissues. اي tissue اخر بيعمل uptake للكاتيكولامينز بنقول عليه uptake 2 carrier، بنسميه uptake 2 carrier molecule. الديجراديشن اللي هو الميتابوليزم بتاع الكاتيكولامينز as you know is carried out by two enzymes. catecholamines uptake is طيب before this degradation is carried out as I mentioned by two enzymes, monoamine oxidase enzyme and catechol-O-methyltransferase transferase واللي هتكلم عنه. First, let us talk about the uptake. The catecholamines uptake is inhibited by drugs called tricyclic antidepressants. These are more important drugs that used for treatment of depression, just like imipramine, clomipramine, amitriptyline. All of these are called tricyclic antidepressants. Also cocaine inhibit الابتيك بتاع الكاتيكولامينز، الادرينالين والنورادرينالين والدوبامين from بواسطة الادرينرgic neurons. and الامفيتامين also inhibit the uptake of the catecholamines. The endogenous catecholamines are metabolized by, as I mentioned, by two type of enzymes, the monoamine oxidase, the MAO, and the catechol-O-methyltransferase. On this slide, we have, this is البريكيرسر تايروزين، التايروزين، البايوسينسز بتاع الكاتيكولامينز، الافتر سينسز stored on the vesicles. Here we have alpha methyl tyrosine, and this is the first drugs we mentioned that affect the biosynthesis of catecholamine, which affect the tyrosine hydroxylase, the rate limiting step, an important enzyme, leading to inhibition of the biosynthesis of the catecholamines. We have also al-methyl dolo, which is taken up by the adrenergic nerve terminal and demethylated and decarboxylated and which beta hydroxylase also add a hydroxyl group, leading to an end product methyl noradrenaline. And methyl noradrenaline, when stored on the vesicles, it acts as a false neurotransmitter. This is the uptake one, which carrier molecule that occur within the adrenergic neurons itself, and uptake two on the other tissues, smooth muscle, cardiac muscle, or glands, or even other tissues. This is the uptake one. Noradrenaline after release act on adrenergic receptors, either alpha receptors or beta receptor, and these receptors either this is the synaptic cleft. Here is the synaptic cleft. If the receptor occur at the neurons, it's called presynaptic receptors. It act if it's occur at the effector organs after both synaptics. It's called after the synaptic cleft. It's called both synaptic receptors. Now we'll talk about the adrenergic receptors or adrenoceptors. Adrenoceptors are designed as alpha and beta receptors. Furtherly, alpha we have regarding alpha receptor we have alpha 1 and alpha 2 receptors, and furtherly alpha 1 receptors also divided into alpha 1a, alpha 1b, and alpha 1d, while alpha 2 receptors are furtherly divided into alpha 2a, alpha 2b, alpha 2c, and alpha 2d, and the last one is only occur in the animals. First, alpha 1 receptor found on the postsynaptic membrane of the effector organs in blood vessels predominate. Actually, alpha 1 receptor predominate on the blood vessels because we find both alpha 1 and beta 2 receptor, but alpha 1 receptors are predominate on the blood vessels. So the sympathetic effect, the pharmacodynamic effects of sympathetic agonist on the blood vessels will lead to vasoconstriction. Also, alpha 1 receptor occur on bronchioles, but on bronchioles, its effect, pharmacodynamic effects, is to produce bronchoconstriction, but not that on bronchioles the predominant receptor is beta 2 receptors, so that the sympathetic effect of the sympathomimetic agonist drugs that lead to bronchodilation. Alpha 1 receptor also occur on a GIT, leading to on a GIT smooth muscle, leading to relaxation, and on a GIT sphincters, leading to contraction, to contract the sphincters. The vice versa of a cholinergic agonist. The cholinergic agonist, as we saw, on a GIT smooth muscle lead to constriction and sphincter relaxation, but here the vice versa, relaxation and of the GIT smooth muscle and contraction of the sphincter. Also on a uterus we will find alpha 1 receptor, and the effect is to contract اللي هو الفيميل uterus. On alpha 1 receptor also occur on a seminal tract في المale, leading to contraction. So the sympathetic activation regarding male genitalia is to stimulate ejaculation, while parasympathetic stimulate erection due to vasodilatation of the blood vessels, while here on the sympathetic it facilitates the ejaculation due to the contraction of the seminal tract. Also, we find alpha 1 receptor on the iris, leading to mydriasis, exactly on iris on the radial muscle, or called a dilator muscle or radial muscle. They call it, it's occur as a radiation muscle, leading to the contraction of this muscle will lead to mydriasis. Also, we find that alpha 1 receptor on a liver, and the activation of alpha 1 receptor on a hepatocyte lead to stimulation of a glycogenolysis, the breakdown of a glycogen. So this will increase the glucose on the blood glucose. Alpha 1 receptor, the selective agonist for alpha 1 receptor, we find alphenyl heparin and oxymetazoline or nafazoline. All of these are selective agonists for alpha 1 receptor. Selective antagonists for alpha 1 receptor, we have prazosin and doxazosine, terazosin, tamsulosin. These are selective antagonists for alpha 1 receptor. It means that, as we know, it can block the alpha 1 receptor, but it can affect the alpha 2 receptor. Non-selective alpha antagonists, these drugs can block both alpha 1 and alpha 2 receptor. We have alphenoxybenzamine and alphentolamine, another drug called tolazoline. These are non-selective alpha antagonists. Alpha 2 receptors mainly located on the presynaptic nerve endings, as we see, and here inhibitory. بالتالي this can lead to inhibition of adenylate cyclase, leading to decrease في calcium entrance, so it inhibits the release of neurotransmitter itself. Presynaptic nerve terminal, the stimulation of alpha 2 receptor causes inhibition of further release of norepinephrine. We'll see this on the coming slide. Selective agonist for alpha 2 receptor, we have clonidine. Clonidine is a selective agonist for this receptor. So clonidine, when act on this receptor like a norepinephrine, can lead to a negative feedback mechanism, can lead to the inhibition of noradrenaline itself. Selective antagonist for this receptor, we have a drug called yohimbine, an alkaloid naturally occurring on a plant called the yohimbe plant. This drug بالتالي can inhibit this auto negative feedback mechanism, can inhibit this inhibitory mechanism. فاليوهمبين can stimulate a noradrenaline release by inhibiting the alpha 2 receptors that occur presynaptically. Non-selective alpha antagonists, as we mentioned, we have alphenoxybenzamine and alphentolamine and tolazoline. These are non-selective alpha antagonists. This is the effect of noradrenaline when it released by exocytosis due to the action potential. This will lead to release of noradrenaline from the vesicles. Noradrenaline can act on either both synaptic receptors, alpha or beta receptors, or can act on a presynaptic receptor. Presynaptic receptors such as alpha 2 receptor. Alpha 2 adrenoceptors occur as presynaptic receptor. Noradrenaline, when activate this alpha 2 receptor, this will lead to the inhibition of the adenylate cyclase, the enzyme adenylate cyclase. So this can prevent the conversion of an ATP to the cyclic AMP, leading to the decrease in the cyclic AMP. And decrease in the cyclic AMP is mainly associated with a decrease in calcium entrance, and this can inhibit the release of noradrenaline itself through exocytosis. So noradrenaline, by acting on these alpha 2 receptors, this can lead to auto negative feedback mechanism. The release of noradrenaline inhibit the release of noradrenaline itself. This is a negative feedback mechanism. Regarding the beta receptors, first we have the beta 1 receptor. Beta 1 receptor mainly occur on the heart. the activation of this receptor by adrenergic agonist lead to increase in the heart rate and increase of the force of contraction. Adrenergic nerve also beta 1 receptor occur on the adrenergic nerve terminal. It can increase the release of the adrenergic neurons. This is the opposite of alpha 2 receptor. All of the beta receptor act through stimulation of an adenylate cyclase. All of the beta receptors, إذا كان beta 1 or beta 2 or beta 3, activation of this receptor will stimulate the adenylate cyclase, and this will increase the cyclic AMP. And if this receptor occur presynaptically, can stimulate the calcium entrance, and this can stimulate the release of the neurotransmitter through the exocytosis. Also, beta 1 receptor occur on the salivary gland, and stimulation of this receptor on the salivary glands can lead to increased amylase secretion. Amylase, the enzyme that is responsible for the breakdown of the carbohydrate, and occur on the salivary gland or with the salivary secretions. Selective agonist for beta 1 receptor, we have a dobutamine and the examoterol. Dobutamine and examoterol, these are selective agonists for beta 1 receptors. We have atenolol and metoprolol. These are selective antagonists for the beta 1 receptor. Non-selective antagonists, for example, we have a propranolol and a timolol. These are non-selective beta blocker. So these can block both beta 1, beta 2, and beta 3 receptors. Beta 2 receptor mainly occur في bronchioles leading to bronchodilation. Also it occur blood vessels lead to dilatation. Like as we mentioned previously, the predominant receptors on the blood vessels are alpha 1 receptor. Also beta 2 receptor occur on the GIT smooth muscle leading to the relaxation, the same effect of alpha 1 receptor. Also occur on the uterus. This can lead to relaxation of the uterus. Also occur on the bladder sphincter, leading to relaxation of this sphincter. Also beta 2 receptor occur in the ciliary muscle, leading to relaxation of the ciliary muscle. Also occur on the mast cell, and the activation of this receptor, beta 2 receptor, on the mast cells can lead to the inhibition of the histamine release from the mast cell. Selective agonists, and this is very important drugs. For beta 2 receptor, we have salbutamol, short-acting beta 2 agonist, and a salmeterol, long-acting beta 2 agonist. We have also a terbutaline, short-acting beta 2 agonist. By default, these drugs are drug of choice for treatment of immediate phase of asthma, because it can relieve the bronchoconstriction very rapidly, so they are very effective bronchodilator. We have selective antagonists for beta 2 receptor. We have a drug called butoxamine. البوتوكسامين أكيد ما حيكون عنده clinical uses, because it is a poison that can lead to bronchoconstriction, it can lead to respiratory failure even, and all these drugs is available for the research and for the research only on the animals or on the isolated preparation. The classification of adrenergic agonists. The adrenergic agonists can be classified to 3 classes. The first one, directly acting agonist. Directly acting agonist means drugs that directly combine to the adrenergic receptor, alpha or beta receptor, and stimulate this receptor, leading to the effects similar to the effects that produced by the noradrenaline and adrenaline on these type of receptors. We have include the endogenous mediators, the epinephrine or norepinephrine, and the exogenous mediator, exogenous drug called the isoproterenol. This is by according to USB pharmacopoeia. Also, this drug have another name called the isoprenaline. This is a British, according to British pharmacopoeia. And also we have a vinyl everine, which is selective alpha-1 agonist. The second class of this drug, adrenergic agonist, we have an indirectly acting agonist. An indirectly acting agonist include amphetamine, cocaine, and tyramine, and tricyclic antidepressant. Indirectly acting because they act through inhibition of the uptake of norepinephrine and uptake of catecholamines, and this lead to the increase in endogenous catecholamines. The last class of these drugs, the mixed action agonists, drugs which can act by the both previous mechanism, have agonistic effect on the receptors, and they also can inhibit the uptake, so they can act indirectly. And these mixed action agonists include the ephedrine, and pseudoephedrine, and metaraminol, which may act directly and indirectly. Catecholamines, they are sympathomimetic amines that contain the 3,4-dihydroxybenzene group, such as they include the ephedrine, الابنفرين, والادرينالين, noradrenaline, الايزوبروتينول او الايزوبرينالين according to the British Pharmacopoeia, and the dopamine. All of these 4 drugs are called catecholamines because they have 2 hydroxyl group on the benzene ring, so they are called catecholamines. They share the following properties. catecholamines بتتميز the following properties. First, they have high potency. High potency means in low dose they activate the receptors, the adrenergic receptors, and they produce effects. This is high potency. Also, they share that they have rapid inactivation by the 2 enzymes COMT and MAO. They are rapidly inactivated by these 2 enzymes. The third properties they share the third property of they have poor penetration to the CNS because they are polar, because they have an amine group, so they are polar, so they can poorly penetrate the brain through the blood-brain barrier. We are already talk about the pharmacodynamic effects of the adrenergic agonist on the previous slides. So now we'll talk about, we'll summarize the clinical uses. The pharmacodynamic effects means the effects that produce whether desired or not desired, but the clinical uses only will select the pharmacodynamic effect that can be intended or can used for clinical purposes for this adrenoreceptor agonist. First, the directly acting are used first in treatment of cardiac arrest. Especially we use adrenaline directly intracardiac. We can use adrenaline for cardiac arrest, or for cardiogenic shock we can use a dobutamine because the dobutamine is a selective beta-1 agonist. Also it can be used for heart block, especially dobutamine and isoprenaline, because they are selective for a beta receptor, and especially a dobutamine for selective for a beta-1 receptor, which occur on the heart. So they can stimulate the heart, both positive inotropic and chronotropic effect, for stimulate the force of contraction and stimulate the rate of contraction. So they can use for these purposes: cardiac arrest, cardiogenic shock, and heart block. Also, they can be used for the anaphylactic reaction, anaphylactic shock, especially the drug of choice can be used is adrenaline. Also, because during the anaphylactic reaction, one of the serious symptoms, anaphylactic reaction can lead to hypotension. This can be opposed, can be antagonized, or can be treated by giving adrenaline injection. The third clinical use for a directly acting adrenoceptor agonist, the sympathomimic drugs, they can be used for treatment of asthma, especially the selective beta-2 receptors, such as salbutamol, salmeterol, and terbutaline. Also, they can be used as nasal decongestant. And the drugs that used for treatment of nasal congestion هم نسميهم nasal decongestion. This drug can relieve congestion, nasal congestion, الاحتقان, nasal congestion. Especially the selective alpha-1 agonists such as oxymetazoline and alvinyl everine, nafazoline, because the nasal congestion occurred due to the vasodilatation اللي بيحصل في النازل cavity, النازل mucosa, النازل blood vessels بيحصل vasodilatation accompanied by excessive secretion. So due to that, selective alpha-1 agonist can constrict the blood vessels, so they can be used topically and even orally to relieve a nasal congestion. Also can be used to prolong the local anesthetic action, especially adrenaline. Adrenaline can be used with xylocaine and lidocaine to prolong the action, the local anesthetic action, because adrenaline can produce vasoconstriction during or around the area of a local to which a local anesthesia is applied. by this vasoconstriction will decrease the blood supply, واصلا الاليميشن بتاع اللوكال انستيك بيحصل نتيجه ليه؟ انه يحصل له امتصاص، يحصل له absorption في السراوندينج بلاد فاسلز، وانه يحصل له بعد ذاك كليرنس يمشي ثرو البلاد فاسلز، يمشي ثرو البلاد ستريم، بلاد سيركيوليشن، سيستميك سيركيوليشن، وبعد ذاك يكون يحصل له اليمينيشن بايذر بواسطه الميتابوليزم او through the renal excretion. فكوننا نعمل vasoconstriction with the adrenaline, this will prolong the action, prolong the effect, prolong the duration of action for the local anesthetic. For example, xylocaine alone إذا كانت duration of action بتاعه about 4 hours, when giving xylocaine with adrenaline, this will prolong the duration of action of xylocaine from 4 hours maybe till 8-12 hours. Also, adrenoceptor agonist directly acting can be used to inhibit the premature labor, especially the selective beta-2 agonists such as salbutamol, because as we know that the human uterus having beta-2 receptors, and this adrenoceptor agonist, when activate these beta-2 receptors, will lead to the relaxation, so that the uterine relaxation will delay the labor. واصلا الليبر عباره عن contraction للuterine muscle، فكوننا نعمل فيها relaxation show we can delay this labor in case of this is desired in case of as in premature labor. Also can be used for hypertension, and the only one that can هو عبارة عن adrenergic agonist and that can be used for treatment of hypertension is clonidine الوحيد. Why? Because it is selective alpha-2 agonist, and we know that the alpha-2 receptor occur presynaptically, so that when activated either by adrenaline or noradrenaline or by exogenous drug such as clonidine, this can lead to negative feedback mechanism through inhibition of adenylyl cyclase and decrease in the cyclic AMP, inhibition of the cyclic AMP or decrease in the cyclic AMP, and decrease of the calcium entrance, and decrease of leukocytosis and release of the neurotransmitter. The only one drug that adrenergic agonist can be used for treatment of hypertension is clonidine. Now we'll talk about last about the indirectly and mixed acting sympathomimetic drug. First, indirectly acting sympathomimetic amines, and this is as we mentioned include the tyramine, cocaine, and an amphetamine, also tricyclic antidepressant. As we mentioned, these drugs act through inhibition of the uptake of the catecholamines, so that the inhibition of this uptake of catecholamines will lead to the increase of the endogenous catecholamines, dopamine, noradrenaline, adrenaline. So this can potentiate the effects of the catecholamines or the sympathomimetic drugs. They sufficiently resemble noradrenaline to be transported into the nerve terminal through the uptake 1, so that they inhibit the transportation of the noradrenaline through the uptake 1. Tyramine in the diet is destroyed by monoamine oxidase in the gut and liver. As we know that the tyramine can be obtained from the diet, especially fermented foods such as cheese, fermented cheese, having the rich of tyramine, so that in case of a patient that having monoamine oxidase inhibitor, MAO-I, this is mean monoamine oxidase inhibitor drug, such as الفينالازين, tranylcypromine, this is non-selective MAO inhibitor. إذا مريض بياخذ في MAO inhibitors وأديناه وأخذ هو بعد ذاك يتناول فود فيه tyramine, this tyramine such as الcheese, this will lead to serious drug interaction or drug food interaction, which can result in dangerous rise in blood pressure. This reaction is a famous and called cheese reaction, so that the patient taking MAO inhibitor is advised to avoid food that rich in tyramine, such as the cheese, to avoid this sudden dangerous rise in the blood pressure. Last or before last, these drugs, indirectly acting sympathomimetic amine, is characterized by tolerance, and we define tolerance and tachyphylaxis when we talk about the pharmacodynamic in the pharmacodynamic lecture. Tolerance, we define tolerance by gradual decrease in the drug response when the drug administered continuously or repeated, that develop in a gradual rate, such as hours or days. Or tachyphylaxis developed immediately in minutes due to the continuous administration. These indirectly acting sympathomimetic amines are characterized by development of tolerance and tachyphylaxis for their pharmacodynamic effects. Last, we have the mixed action adrenergic agonists, which act by two mechanisms: by increasing the endogenous catecholamines, sometimes by increasing the release of these catecholamines, and sometimes by increasing by inhibiting the uptake of these catecholamines. So the overall effect is to increase the endogenous catecholamines, and partly by direct activation of the adrenergic receptors. Mixed action drugs include also mixed action drugs stimulate the release of norepinephrine. In some references you will find that also they inhibit the uptake. So the overall effect to stimulate the endogenous or to increase the endogenous catecholamines such as the norepinephrine, and they activate both synaptic adrenergic receptors, alpha and beta receptor. They include ephedrine and pseudoephedrine. Ephedrine is available as nasal drop for treatment of nasal congestion. Also can be available as a tablet for treatment of asthma, but seldomly used for this purpose. Pseudoephedrine available as oral tablet for treatment of nasal congestion also. Ephedrine induce bronchodilation, so it have a role in the treatment of asthma. Pseudoephedrine is used to treat nasal and sinus congestion, as I mentioned, and is available orally as in the form of tablet. Also, it's incorporated in the cough syrup as one of the component of the cough syrup.